In progress.
All right, so we are joined by the Nurse Liaison for Methodist Rehab here in Jackson. Wonderful nurse, graduate of Madison Central High School, Katie Rives, formerly known as Katie Mua when we were growing up. We are recording this for all of our Madison County schools, Madison Central, Rosa Scott, Ridgeland High School, Germantown High School, the Academic Options Center, and I've got a room full here with me at Velma Jackson, and we are getting into the health science career cluster. And nursing obviously is a very popular field. It's a very in-demand field, but it's a very demanding field, which we'll talk about here in a second. But before we get into all of your nursing, because I know you're super passionate about it, super excited about it, let's start with Madison Central, because we're here with Madison County Schools, class of 2000 with me. It's hard to believe that's about to be 23 years. But talk a little bit about your high school experience, because you came through the same school and same school system as the young people that are going to be watching this now and watching this later.
Yeah, and I can't say enough good things about Madison County Schools. I mean, I went to Madison Central. My husband went to Madison Central. You know, we still live in Madison. My kids go to Madison. Well, one of my kids goes to Rankin, but most of my kids go to Madison. Sorry, there's a distractor. And the experience that I had at Madison Central was just positive. I needed a lot of guidance, I feel like, in high school, and I got that, especially from certain teachers. There were teachers that stood out, and I still think about those teachers, like Mr. Dow. I mean, come on, you know. You think about those people for your whole life, really. But
and not only that, we had such a memorable class. I always tell these kids, even though you're accepted to the rule, because you and your husband are two of the few high school classmates that are together, but for the most part, you kind of go your separate ways. But those memories and that experience does stay forever. Now, you told me yourself when you graduated from high school, you had no idea what you wanted to do. And we did not have programs like this. We really didn't have anybody talk to us about the realities of the field and reasons to get into the field. So you had a different path into nursing. It was not the traditional, I'm graduating from high school, I'm going to get my prereqs, I'm going to nursing school. You took kind of a winding path. So talk a little bit about that, because I think it's kind of interesting that me and you are similar and we kind of changed careers later in life.
Yeah, for sure. If somebody had told me that I was going to be a nurse when I was 18 years old, I would have laughed and said, "You're crazy." Absolutely not. Because I thought it was something totally different than what it is. And when I was 18 years old, I really didn't know what I wanted to be. When I went to Southern right out of high school. I majored in art. So just a total, 180. But I just wasn't sure. I wasn't sure what I wanted to be. I was interested in a lot of things, and I didn't know how to kind of channel those interests into a career. And I really wish that I had somebody to kind of help me figure out that maybe if you don't know what you want to be, don't go to a 4-year university right away. I went to nursing school at Hines when I was 30 years old. And I can't say enough good things about that. Community college is amazing for helping you figure out what you want to do. And the price point, I mean, what you're getting for the price is just amazing. And I'm still paying my student loans from when I went to Southern in 2000, Greg. So, and I don't use that degree at all. I mean, I did get my prereqs done there, but I don't use that. I mean, I don't do anything in art. I love art, I still love art, but I don't make art.
Yeah, and now with 20 on the ACT, you can get those prereqs knocked out for free
at
community college. So
yes.
It is and we talk about that a lot in here. It's not, you don't have to just jump into the 4-year university right out of high school. You can get those same classes for a fraction of the price at the local community college, whether it's at Hines, Holmes, East Central, or wherever. And that's going to transfer. And then, the Hines Nursing School, I know we have other nursing schools in the state. We have actually a student with us now who's one of our alumni who's in nursing school at the W. They have a great program. So does Mississippi College, Belhaven, Alcorn. But we have some great community college programs that are going to turn out the same certification with the same job placement.
Right. And that's what I wanted to say. I went to Hines and got my ADN and am a registered nurse. Okay. I don't know what the percentage is, but over 50% of nurses in the state of Mississippi have their ADN, not their BSN. Now, I am in school right now at the W, speaking of the W, to do my RN to BSN, and it's all online, and it's all, you can do it while you work.
Cool.
And really in nursing, you can get just as far with an associate's degree as you can with a bachelor's. Now, the bachelor's comes into play if you want to be like a manager, but sometimes not. Sometimes experience in nursing is more than that piece of paper. Because my boss only has an ADN from Hines, and she's the director of Nurse Liaisons at Methodist Rehab. So, it's just really all about working hard, and I love to work hard. I love to work. So, I love nursing because of that.
Now, one thing you did mention is one thing that, a lot of young people think, they just think I'm going to be a nurse because it's easy money. And it's the stuff they see on TV. I know we've all watched the hospital shows, but that is a very, very small fraction of what nurses actually do. So before we get into what nurses actually do, talk about nursing school and what you had to know, what some of the prereqs were, some of the things that a nurse is going to be expected to ace before they ever step foot in any type of clinic or hospital.
So nursing school is notoriously hard. Everybody talks about how hard, and it's that way. It is hard. I mean, in high school, I made wonderful grades. I thought I was real smart, until you go to nursing school and it's hard, and at Hines, we would have people that didn't pass and you have to repeat. And that's kind of the norm for people to have to repeat a semester because it's very challenging, the program, once you get into it. Now, the prereqs, you're taking English and math and those things, and you need all that foundation. And for me, there was such a big lump of time from when I took my prereqs, which was like in the early 2000s, to when I went to nursing school in 2012. Technology had changed so much in that time. I really had to catch up. I had a lot of catching up to do because I didn't have, for 12 years, I wasn't in school, and it was like a whole different world. Everything is, online, and I had a huge learning curve. So I would say, for me, I had to take a couple classes that were like computer classes just so that I could learn how to go through the program.
Yeah, and that's a great point because, we have all ninth graders here, and they'll have the opportunity as either 10th or 11th graders to get in the health science program at our Madison County Career Technical Center, which prepares them for those health-related fields. So learning the vocabulary, learning the procedures, and learning that software now is invaluable because, like you said, you'd be shocked how much technology changes in just a short amount of time.
It really does. I mean, even from when COVID first started, we wouldn't have been having this meeting, 2.5 years ago, we wouldn't have been doing this. This wasn't heard of. So it's just crazy how things have really changed. And with nursing, there's just always innovations being made in the healthcare realm. Really, changes are just being made constantly, and I love that about this career because it's never the same, and you're never bored, and it's just always something new to learn.
Yeah,
so I love that.
Yeah, and like we just mentioned, it's not all like Grey's Anatomy with blood and guts all the time. But
No.
I think it is very important to understand that if you're going to be a nurse or any in healthcare profession, you're going to see blood, You're going to see bodily fluids. You're going to have to touch people. You're going to have to be around bad smells. So if you're, people say, I want to be a nurse, they make good money. That's great. And if you can pass nursing school, that's great. But if you can't handle that stuff, that's a reality. And no matter what field of nursing you're in, because it is very diverse, but that the human body is the same no matter what department you're in.
Right. That's a really good point. And when I was in high school, all of those things are what made me think I cannot be a nurse. I cannot do gross stuff or whatever, blood or whatever. I thought I couldn't do that. But you can. And there's so much more to nursing than just that. Now you do have to get through that, but it's like you just do, you just get over the smells and you get over the stuff, and ultimately you're helping people, and that's what you end up caring about, and you don't care about the gross stuff. I promise you, as an 18-year-old, that I was like, absolutely not. I will never look at somebody's naked butt. No, but it's just totally different. And then once you get into being a nurse, there's so many different things you can do. I don't see a lot in my job. I don't see a lot of blood and guts, and I don't touch a lot of patients. But I used to when I was a floor nurse. There's just so much variety here that you can do,
Yeah, and another thing, and we're hearing more and more of this from some of these college professors. I don't care what field you're in, but especially in nursing, people's lives and health is at stake. You got to be able to talk to people. The verbal communication skills and the written communication skills are invaluable. You got to be able to chart exactly right. You cannot make a mistake. You can't write like you text. If somebody is dying or somebody is really sick and been injured, you have to be able to talk to them like you would talk to somebody you've never met before. You can't talk to a patient like you talk to your friends. So these kids want to get so upset when we make them present in front of a class, but we're not doing it to be mean. We're doing it because in any profession, especially when people's lives and health is at stake, you have to be able to communicate.
Correct. And that is something it seems like it's affecting this generation a little bit more than it did us, maybe because we weren't shooting each other 2 sentences of text. The communication is really, I don't want to say lacking, but it's something they have to overcome because they're so used to the texting. I have teenagers myself. So, I'm like, you'll ask them a question and they'll be like, no, I'm like, that's not an answer. You have to answer me in a complete sentence. And it is important skill to have.
Yeah. And something else you mentioned, you said you used to be a floor nurse. Now you're on the rehab side and you supervise people, but nursing is unlike most healthcare fields, because if you're a doctor, you're locked into one specialty pretty much for good. But nursing is more mobile. I know people that are in, they work part-time over here and they work full-time over here, and they're in 2 completely different disciplines. So talk a little bit about that, because nursing can be moved from specialty to specialty.
Yes. And that's another thing, like I was saying, you can't get bored as a nurse. when I first started out, I worked at UMC in oncology. And I worked there for a year. Yes, totally different than what I do now. That was an amazing experience. And I learned so much from that. And then I was like, this is not exactly what I want to do. So you look for other jobs, and there is just such a wide variety. So I went from UMC oncology to Methodist Rehab brain injury. And that's what I've been doing, pretty much my whole career is brain injury and Methodist Rehab. But there's so much. I have a friend that she started in med surg, and now she's a NICU nurse practitioner. You find something that you're interested in, and you can go that way. And if you change your mind, you can go another way. As long as you have that RN, you have so many options. And if you really, really, really don't want to put your hands on patients, you have to get through nursing school. But if you can get through nursing school and you just don't want to actually do hands-on, there's so many other things you can do. Case management, legal consulting. What I do, I go through patients' charts and evaluate patients for rehab admission. So there's just a million different ways to take it.
Yeah, but that also means you have to work well with the other areas, because if
Oh
you're
yeah.
dealing with brain injuries, you're going to have to be able to communicate with the PTs and the PT assistants to make sure they're rehabbing those injuries correctly. Because again, you have people's lives at stake. If something is rehabbed wrong, it can cause serious complications.
Yes, absolutely. Yeah, brain injury is it's a whole world. It's a whole world. And Methodist Rehab is so good with handling brain injury rehab and spinal cord injury rehab, but it's just a whole nother world when a patient has a brain injury. If you have a family member that's ever had a brain injury, there, it changes everything about the person, and the rehab for that is very nuanced and just very specific in the way it has to go. And being a nurse for brain injury patients can sometimes be very challenging, but it's no more challenging than when I was an oncology nurse. It's just totally different. They're just challenging in different ways.
Now, another thing, and I know the trend is changing, but there's a huge demand for men in this field. For years and years and years, it was pretty much a female-dominated field, but there is a need and a huge demand for male nurses at this time. So, talk a little about that trend you've seen and why there's such a need for men in the nursing field.
Oh my gosh, I just think men bring something different to it. For one thing, I mean, not to be sexist, but for one thing, men are very usually can lift heavier than a woman. Not always, but it's awesome to have a man on your team. If you're a floor nurse and there's a male nurse, that's amazing, and they just bring a different perspective. I mean, anybody can be a nurse. Male, I would be super, super proud if I have 4 sons. If any of my sons became a nurse, that would be, amazing to me.
Yeah, and you have to look at too, at the end of the day, it's about patient care. A patient could be more comfortable talking to a male about a
Absolutely.
medical problem.
Yes.
Same thing with a female. That's why there's such a need for female doctors, because having a diverse staff when it comes to people's safety is very important if they're going to communicate what's really wrong with it.
That's so true, Greg, because yes, somebody might not open up to me, but maybe they would open up to you. Yeah, very true.
Well, now, before I get to the questions, I do want to also talk about this demand is going to keep growing. People
Yeah.
are older, technology is expanding, and especially, we have kids, that aren't like you and me that stayed here. There's people that say, I want to get the heck out of Mississippi. If you want to get out of Mississippi, nursing could be a way to do it. The military,
Oh my gosh.
military is always
Yes.
nurses in all branches. The large research hospitals in the big cities, Atlanta, Nashville, New York, Houston, some of the large hospitals, they're always looking for nurses. So if this is a field that you could get your RN here in Mississippi, maybe work for a little while to get some experience, then this is a field where you can go live in the big city for a little while. And also, I know a young lady that she speaks in the class sometimes. She did a 6-month rotation in Santa Monica, California, and now she's at Emory in Atlanta.
Yeah.
So these people
Yes.
on both coasts.
More and more people are doing travel nursing. I mean, that's just a huge thing that you're seeing. But even if you just want to completely relocate, yes, I look at jobs in other cities all the time. I just like to look, but there's never a shortage of nursing positions. There is a shortage of nurses every single day at my job, and at every hospital that I go to the 3 main hospitals, Baptist, UMC, St. Dominic's. There's a nursing shortage, and they're limited on what they can do because of staffing. And that is not getting any better anytime soon. We need more nurses, more. There'll never be enough.
Yeah, and that's why, and we have about 13 students in our health science, at least for Velma Jackson, at the health science, at the VOTEC, and they're really getting a look into it now. So I would encourage anybody interested, in 10th and 11th grade, to go ahead and get and start getting a little bit of experience as a high school student. Then you can really see what it's all about before you take those steps into nursing. Because like you just said, right now, if you want to be a nurse, you can find a job. So
yes, absolutely.
It's not going away. But I do
the Health Science Academy is amazing. My son is in the Health Science Academy, and they get to shadow once a semester. And that's just for him. He's 16 years old, to to go into an ICU and get to see a patient that's just had a stroke, or that is an experience that I can't imagine having at 16, but he's already had it multiple times.
Yeah, but I do got some great questions here. I'll get to as many.
Okay, I'm ready.
These are all ninth graders. The first one is Randy Miggins, and he asked, how has nursing changed your life?
Nursing has changed my life completely. Before I was a nurse, I was kind of bouncing around I worked at a preschool and I worked at a retail store, and I just didn't really know what I wanted to be. And it wasn't until my dad actually had a very, very bad car wreck in 2006, and he was paralyzed, and he went to Methodist Rehab for his rehab. And that is where I discovered that I was interested in healthcare. Now, it was 5 years later before I actually went to nursing school, because I had small children and I was, doing all that. But, it's just amazing the things. That was a terrible thing that happened to our family, but it ended up bringing about all these changes that were amazing. I never would have known that I was even interested in nursing. And then I never even had heard of Methodist Rehab until that, So it just amazing that how your life can change. So to me, nursing, I mean, it's my life is being a mom and being a nurse. And those are the two things that it's just all the time. My kids make fun of me that I'm like the Methodist Rehab, like sales lady, because I love talking. I love talking about my job. I love talking about Methodist Rehab. I just love it. So to me, if I hadn't become a nurse, I can't imagine what I would be doing. I would not be nearly as fulfilled.
Oh, I know the feeling. This is Taylor Jones, and she asked, what do you enjoy most about being a nurse, and what's the craziest thing you've ever seen as a nurse?
Oh my gosh. Okay. So the thing I enjoy most is definitely the connections made with the people. And in rehab nursing, it's just even more strong, because that rehab patients come and stay for several weeks. And so you just really get to develop those relationships and get to know those people really, really well. And that for sure is my favorite part. I love with my job now, the best part about my job is I get to walk into a patient's room after they've had a car wreck or a stroke or whatever, some terrible thing has happened to them. And I get to walk in and say, I'm Katie from Methodist Rehab, and I'm here to talk to you about getting your life back. Because that's what we do at Methodist Rehab. We teach people how to live again with whatever limitations they've been given with their injury. And so people are always so excited to see me, and that's my favorite thing for sure. And I know it's not about me personally, it's about Methodist Rehab, but it still makes me feel great. The craziest thing that I've ever seen, oh gosh, a lot, Greg, but I guess one thing, I was punched in the face by a patient once on the brain injury floor. So that's probably the craziest thing that I've experienced. Oh. And I'm fine. I'm still fine. But that was pretty crazy.
Oh, I mean, anytime you're dealing with neurological injury, there's a lot that can happen. This is Caitlin McGee, and she asked, how do you handle stressful situations?
I mean, stress is just a part of, I guess, being an adult. Stress is just a part of your life all the time, and you just learn how to cope. I like to do things outside that really helps me with my stress, like kayaking and hiking. And you just kind of have to find your thing that makes you feel better. But that is really important, because work is not life. And I have to juggle that all the time, because I love to work, but ultimately work is not my life. You have to find some balance there. And I think that's hard to do. Something I have to work on every day, really.
This is a great question. This is Tyrion Harris, and he asked, what is the most challenging aspect of meeting a patient's needs?
So every patient is different, and that's the thing I love about being a nurse, but it's also challenging because so different in just nuanced ways. And there's a lot of family dynamics, and it's frustrating sometimes when you see a problem with a patient or, a social problem and you can't fix it. You can't fix somebody's family life or substance abuse or whatever, and you see a lot of that. That's challenging.
Yeah, but then again, that goes back to the communication. You really
Right.
you have to communicate with people, and it's not just talking. You got to be able to listen and know what's going on, not just mentally but physically. Nurses have to be great speakers, but they got to be great listeners. And that'd be anybody that works in healthcare. All right, this is the last one I got from the students, and this is Morgan Thompson. That's the one whose sister is up at the W studying to become a nurse now.
Okay, cool.
Yes. What helps you develop your mindset when it came to being a nurse?
So really the experience with my dad, he was in a car wreck and then he was at UMC for several weeks and then at Methodist, and that just changed my whole life. That whole thing just changed my whole life. Before that, I watched Grey's Anatomy and I thought I knew what being in a hospital was like, but that experience, I know.
I love the show, but it's so unrealistic.
Yes, I know. Now I'm watching, I'm like, put the side rails up. That just changed everything for me, that experience. And I encourage, you to step into those situations. If you have a family member that's at the hospital, go visit them, go see what the vibe at the hospital is just my favorite because it's like full of energy and you just can't find it anywhere else.
Absolutely.
Just put yourself in situations that you wouldn't normally be in and see what happens.
Yeah. And I agree. Especially when it comes to healthcare, experience is the best teacher.
Right.
Because I hear healthcare people say all the time, I learned all about all the anatomy and muscles in school, but they didn't teach me how to deal with somebody that's throwing up all over me.
Right. Or that punches you in the face.
Exactly.
Yeah.
All right. Well, I just got two more questions. We're almost out of time, but I just got two more questions. One funny and one serious.
Okay.
The first one is, these kids love making fun of me for obvious reasons. And we've known each other almost 30 years now, and it's amazing how long we have known each other. But just to make them feel a little bit better, have I not always been the goofiest person, just the same way I am now?
Yeah, I think you're definitely very similar to what you have always been like. So not much. You can change some things, but some things don't change.
All right, so they'll be glad to know that because I'm the butt of a lot of jokes, but I get it. I make fun of teachers too. Now before we go, and we thank you so much for joining us.
I thank y'all. This has been great.
But it's important. You were in these same schools, same school system and same high school, and it's amazing how much they have now that we didn't have. They don't want to believe me, but the amount of things that they get now that we did not have in high school is just exponential, and they need to make the most of it. But like me and you both, we changed careers at 30. But why does nursing need these young people to strongly consider getting into it? Because like we said, it's not going away, but it needs good, young, hard workers.
Yes, absolutely. Healthcare that's life. That's what life is, taking care of people. It touches every part of life. And without young people stepping into these roles, we're getting older. I would love to see one of your students take care of me in 20 years when I fall and break my hip. I want one of your students to be my nurse. That is, it's just vital that they get involved. And the future is technology and the future is healthcare. And that's just the truth. That's just the truth.
All right. Well, again, Katie Rives, Methodist Rehab Center right here in Jackson, Madison Central, class of 2000. Please give Ryan my best.
I will. Thank you so much, Greg. Y'all have a great day.
Thank you. And again, thanks for fitting us in today. I know you're busy.
No problem. Y'all have a great day.
All right. Talk to you soon.